Hi, I'm Dr. John Rawa. I'm a diplomate for the American Academy of Dental Sleep Medicine, and I am president and owner of Dentistry with a Touch of Art. We have an airway-centric dental office. Focusing on the airway and not just the teeth is a paradigm shift to address the root cause of airway and breathing problems that is pandemic in our society. Our soft, non-chewed diets have caused our jaws to become underdeveloped and thus causing airway and breathing problems both awake and while we sleep. An underdeveloped maxilla causes the patient to mouth breathe and thus develops nasal disuse. Nasal breathing is paramount in the correct way of breathing. Nasal breathing produces nitric oxide, which enables more oxygen into our bodies. The proper oral rest position is lips together, teeth apart, tongue to the roof of the mouth. Another area of airway-centric dentistry is evaluating the tongue for full range of motion and function. A tongue tie, also known as restrictive tethered oral tissue, can hamper the proper growth and development of the maxilla by being tethered to the floor of the mouth. The tongue's house is the roof of the mouth, and with every swallow, it flattens against the maxilla and helps to grow it. There are two types of tongue ties, an anterior and posterior. An anterior tongue tie is usually seen at birth, with the newborn having difficulty breastfeeding. This is usually addressed within the first few days of life. The posterior tongue tie can easily be overlooked, but can cause problems with sleep, speech, and growth of the child. The posterior tongue tie causes the base of the tongue to rest low and back instead of high and forward. Tethered oral tissues can be released using our CO2 Solea laser with minimal pain and bleeding. To release, it only takes seconds and helps to restore the proper function of the tongue. Another service we offer as an airway-centric practice is oral myofunctional therapy. This myofunctional therapy is a highly effective physical therapy exercises used to improve nasal breathing, bite, and proper oral rest position and swallowing.